Good evening, Tewksbury. I'd like to call to order the May 15th, 2025 meeting of the Tewksbury Board of Health. The time is 6:02 p.m. This meeting is held in the main hall at Town Hall and is being recorded and broadcast live on Tewksbury TV. I would have us stand for the Pledge of Allegiance. To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Thank you. So we'll take a roll call. We are all here minus Chris. So we have Pat, myself, Susan, George, and Steve Sadwick. So first on the agenda, we have the minutes of, approval of minutes for April 17th, 2025. Are there any corrections or edits that we need to discuss?
I have none.
Okay, hearing none. May I have a motion to approve the minutes?
I motion to approve the minutes.
I second that motion.
Okay, motion has been brought forward and seconded. All those in favor say aye.
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 Any opposed? I hear none. Chair votes aye as well. Great. So next we will have the administrative hearings. So we're going to entertain a motion to open the administrative hearing for Smitty's Liquor at 1091 Main Street regarding a second offense tobacco violation reported on April 28th, 2025. Do I hear a motion to open that?
I make a motion that we open the administrative hearing.
And I second that motion.
Okay. Motion has been put forward in second. All those in favor say aye.
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 Any opposed? I hear none. Chair votes aye as well. So I'm going to ask for Smitty's Liquors to come forward. So this is a hearing concerning the sale of tobacco product to a person under the age of 21. So I want to turn the floor to the health department, or and actually, yes, Ron is here too. So you can come forward, please, so that you can include that information for us. And so I'll have you both state your names and your addresses and write that on the paper for me. So your name and your, you can say your name and your address and then just write it down on that piece of paper. And then just turn on the mics.
Dean Graffio, 52 Pinnacle Street. And Ron Beauregard, health agent for tobacco control.
Perfect. Ron, would you like to start off?
Just want to be sure, there's not a dispute in facts, right?
No.
Okay. So, I'll just really be short. We did do some routine compliance checks that day. That would be the April 28th, 2025. And unfortunately, a mistake was made at the store, and so a sale of tobacco products occurred. I don't think there's really, this constitutes a second offense only because there was a previous offense on August 7th, 2023.
Okay. And do you have anything? Would you like to speak? Or?
Yeah, so I had a new employee from when that first offense happened, and she's a stand-up great employee. The lady made a mistake. She was on her phone dealing with her mother-in-law she takes care of. She got distracted and she did not card the tobacco. She just passed a compliance check for a lottery about 2 months ago. I mean, we take our business serious. I don't serve underage. I don't carry any products that underage kids look for. Tobacco, rolling papers, Zins, vapes, cigars. I do not carry any of that. The only thing I carry is cigarettes, and it's really just a convenience add-on purchase for alcohol. So we just have that as a convenience, really. And, I mean, my fine's worth more than 3 weeks' worth of actual sales. So, I mean, you know, the lady made a mistake. She, you know, wanted to quit. I told her no. She's trying to, like, supplement funds to pay for her, you know, her son's wedding. I mean, she made a mistake. It was a human error. So, you know, we went over, I put new signage at the point of contact again. We went over the, you know, the importance of carding every tobacco sale, which we normally do. And I also added that we not use cell phone usage behind the counter. Yeah, so to prevent the distraction, because that's what happened in this case. So, you know, after implementing that, I feel confident. We carry on our business. I've never gotten a lottery or an alcohol compliance check. We do take it serious. I don't want you to think that it's something I just poo-poo off. It was a human error, and, you know, unfortunately, it's my second time. So, you know, we take ownership of it, and we just make corrective actions.
Thank you. So obviously with the Board of Health, we're responsible for enforcing the regulations, and the question before the board is really understanding if the violation occurred or if not. And so the circumstances and everything, unfortunately,
Yeah, it occurred.
You know,
yeah, I'm not disputing
So
that, yeah.
does the board have any other questions or?
I have no question.
I was going to question, you know, what you have in place right now to make that not happen, but from what you just said, it's the new signage for,
I mean, I had signage there, but I just you know, put another one up, just did more at that point of contact, like I said. And the one new thing would be, I asked them just not to use their cell phone behind, you know, behind the counter. If something's happening, just, I mean, she was by herself. I had taken off to the dentist that day. It's a little tougher, but if she can just walk outside for a second, the customer usually see that, you know, she's out there, and yeah, that's really the crux of it. So that's the real new thing I did was implement that. We just got to prevent distractions, and that's really what happened. It's generally, because this is the second time it's happened on a Monday morning or Monday afternoon, and it's generally not a busy time. What's funny is, and I talked to the chief about this, about alcohol sales, young kids will come in at 9 o'clock in the morning a lot when we first opened to try to purchase alcohol. So, like, we're kind of on our game. My people know that. But in this case, you know, it's just a Monday afternoon. It was quiet, and she was on her phone, and, you know, she didn't take the necessary steps. You know, I feel bad. She's a great employee. You know, she wanted to quit. I told her no. She wanted to come tonight. I said you didn't have to. She's a great lady. So, you know, human error was part of this, but I feel like with the cell phone usage put aside, I feel like we can, you know, mitigate this and fix it.
Okay. Any other questions from the board? No. All right, seeing none, can I do I have a motion to close the hearing for Smitty's Liquor?
I motion to close the hearing for Smitty's Liquor.
Okay, motion has been put forward and seconded by Pam. All in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So we're now just going to deliberate. Public may observe but not comment. So then basically we just kind of have a discussion on, okay.
Yeah, I mean, I'm open for any suggestions you might think that would work. Yeah, I'm an open book.
There are other liquor stores that have other things in place, such as, I know I get offended, well, I should be lucky because they asked me for my license, is that everyone is asked for a license. And doing that, I know sometimes can be a pain, but it certainly stopped them from any violations. It's just something to think about and discuss.
Yeah, I mean,
Just
so
to
we
protect you.
right. That is really our policy on cigarettes. Is if someone's coming up because I already have $1,000 fine, is to ask for the ID. Like I said, it's not. We don't generally get people that walk in just for a pack of cigarettes. It's more of an add-on to the actual sale, which is the only reason I even carry them. Like I said, my fine's worth more than 3 weeks worth of sales of cigarettes, right? So it's a convenience thing. Yeah,
So I'm
I
just-
understand what you're saying, but that is our policy, is to
I'm just going to interrupt just because
Yeah.
there's, we just closed the part of the meeting part,
okay.
so I apologize if
No
that was
problem.
not clear. So what we're going to do is just basically, we're going to deliberate and we're
Oh,
going to
okay.
vote on what's to occur. And I understand, like,
Yeah.
and I totally understand that, and I want you to be able to speak. So do we have a motion regarding the disposition of this case, of moving it forward, the fees? So I believe it's a $2,000 fee for the second offense. Steve?
Yeah, just out of curiosity, it may be worth asking tobacco control health agent if that's mandatory. Like, I don't know what,
Yeah.
are we operating under state regulations? Are we operating under town regulations? And then is this mandatory or not?
Sure, I can speak to that.
Absolutely.
So what happens here is the correction order is issued pursuant to State Regulation 105 CMR 665. That regulation is the primary, basically sole enforcement of it is through local boards of health, as is stated in the regulations. Those higher fines that came into place in June of 2020 were the floor, not the ceiling. All three entities that have legal and technical support for the boards of health, the Mass Municipal Association, the Mass Association of Health Boards, and the Mass Health Officers Association, got a myriad of questions, and they still do get them. But the one thing, in regards to the fine itself, they have indicated to us that unless there's a question of fact as to whether or not the sale occurred, that the fine is mandatory.
Correct.
In regard to the suspension, when you did change your regulations relatively recently, you decided to mirror the state regulation as opposed to keeping your, I think it was a mandatory 7-day suspension for a second offense. Instead, you mirrored the state regulation, which indicates at least 1 day and up to 7 consecutive days. So it's sort of a combination there of factors. So.
Okay, so if I'm understanding correctly, the $2,000 fine is mandatory, and then per our regulations, we can decide on a 1 to 7 day suspension.
Discretion.
That's correct.
On our, like, we can vote on that or put that forward if that's something that,
Yeah, in my experience with other boards of health is, while the fine is mandatory, depending upon, economic circumstances and such like that, and difficulty to pay and burden to pay, that, sometimes we can extend that out months. I've known one board that extended out, I think, 10 months.
Okay.
But the norm, extension is, a couple of months or such like that.
okay. And is there a time frame that they are to pay the 2,000?
Well, 21 days is the,
And we have discretion too about if we were to do the days, 1 up to 7.
Correct.
But I don't know if anyone else wants to speak on it, but I have no reason to have any other action. So I'm just telling you that's where I'm standing.
Other than
I think they got the message.
Yeah, other than
And
the
I
fine,
think-
correct?
yes.
Yes,
I think they'll do fine
okay.
going forward.
Any other discussion on this matter?
I side with him on that.
Yeah, okay, so do we have a motion put forward? And then I would suggest that we decide on a time frame for payment. So if we want to keep it to the 21 days, if we want to extend it, because we are able to do that if,
well,
maybe not. I don't want to speak out of line, so,
it's been done.
okay.
Okay.
All right, thank you.
Yeah.
Okay, I should have probably asked that, so thank you. All right, so, so it has already been paid?
Oh, no, I'm sorry, it's
No,
been
no.
done the extent, no, because there's not a due date yet.
Okay.
The due date hasn't come yet. No, what I meant has been done is that you asked for the authority to do such a thing, and, perhaps to the letter, no, but, I mean, you know what my feeling is, just if I can expend my feeling to it, is that this is not meant, first of all, the program, of course, doesn't get it. The Board of Health doesn't get it. It goes to the general fund.
Yep.
That's what it's been directed by the state law. So, it's meant for deterrence action. And in the future, I know there was a question in regards to ID scanning, or perhaps like in scanning, and I am working with a group of retailers right now to experiment with the idea of maybe perhaps, because as you mentioned human error. It's a mistake, and she was very remorseful, very good. I could just tell. Yeah, I spent some time there. This is why I do a difficult thing by going in right afterwards, but I believe in it strongly, and I thought this was a case in point. This was a woman who felt very badly about it. So these are the moments when I, having done this since 2001, I like to pitch the idea, but if the retailers don't support it, then so be it. But instead of having this heavy burden on both sides, because it's never easy on our end either to issue the citation, that I look at, I have a dialogue right now with the Cannabis Control Commission, because to me the difficulty and the challenge is, if someone like myself goes to a marijuana establishment, give it up, give it up, give it up, all the time. The vast majority of them have a mandatory scanning for even entry. So the question for me is, can we set up a system whereby the tobacco purchaser is also conditioned to understand that the product is going to require a scanning? There's a lot of problems with it. There's cons, cost. Some things don't scan. There's several things, but I want to just get in the dialogue. And I mean, before I'm kind of toward the latter part of the career instead of the beginning of the career, and I could just go through the motions for my remaining time. But I'd rather try to make a system better. But I have to get that feedback from the retail. So I'm going to have Zoom meetings. And Dean, I'm going to invite you as well if you want to participate. Yeah. I want to know the truth, meaning all the facts as to whether this is a road to go. Maybe we could even do it as a pilot program.
Okay. Thank you.
You're welcome.
Okay, so do we have a motion that the fine is to be paid within, the $2,000 fine is to be paid within the 21 days?
Are we able to extend that? That's what we were just discussing?
Yeah, I mean, would it be possible doing like two? I'll do like half on the 21st day and half 30 days later.
I make a motion that it's, so we make the payment to 60 days in the two installments.
If I could interject, I'm not trying to in any way, shape, or form make judgments about people being good for something, but we sometimes get that request, and of course, by all means, do that. But to me, it's inconsequential whether it come in two parts or just a pure extension.
Okay.
I think if there was any history of issues for a particular entrepreneur in the past, maybe that wouldn't be favored, but just a simple, whatever the extension would be.
What if we entertain a motion that the $2,000 need to be paid on or before 60 days from April 29th, which was the notice? So that's, I don't know, June. So June 29th or 28th?
Yes,
Do you have a motion for that?
June 27th.
So actually, there's a motion on the floor already
Oh,
that it was a mandatory fine of $2,000, and now we're looking to amend that motion
Thank you.
for 60 days from the date of notice.
okay, yes. Thank you.
Yep.
I'm still new at this.
I'll amend that motion to make it 60 days from the date in question that you said.
Because I have a Zoom meeting with a bunch of retailers.
Do I have a second on that amendment?
I second it.
Okay, so there's been a motion and an amendment to pay the fine of $2,000 on or before June 28th, the 60 days. All those in favor say aye.
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 Any opposed? I hear none. Chair votes aye as well. So it has been placed that Smitty's Liquor has to honor before June 28th to pay the $2,000 fine.
Thank you
Thank you.
to the board. I appreciate it.
Thank you.
Okay. Appreciate that. Thank you. Have a good day.
Thank you. Yeah. Yep.
All right. Hopefully this next one goes a little smoother. So I'm going to now call the Tobacconist, 1875 Main Street, to come in front of the board. And I'm going to entertain a motion to open the hearing for the Tobacconist, 1875 Main Street, concerning a correction cease and desist order, offering for sale flavored tobacco products and failure to possess manufacturer documents certifying tobacco products are not flavored, that occurred on April 9th.
I make a motion that we open the administrative hearing for the tobacconist on Main Street.
Okay, do I have
I
a
second.
Okay, so a motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So this hearing is to address those violations. Ron, would you like to?
Sure. So in brief, on April 9th, I received a call that there was an inspection ongoing at the Tobacconist in regards to, it's a routine type of, the Department of Revenue does regular inspections on all holders of tobacco product sales permits. Now, it's kind of humorous as I go from store to store there, when I ask for manufacturing documents, as we call them, in the regulation I mentioned just earlier, 105 CMR 665, it requires that, of course, no sale of flavored tobacco products occur. And it also requires that all retailers holding a permit have in their possession at the store a document to certify each product is indeed not flavored. So I got the call, I was at a meeting, and I learned that there was some number of materials, tobacco materials, that not only had some questions in regard to, let me back up, the Department of Revenue, what they look for, and this is why there's sometimes confusion when I'm looking for the documents. Sometimes the person behind the counter will say, oh, here you go, and they'll give me invoices. And they've mistaken me for the person who works for the Department of Revenue, because the invoices, what they do is they do show that the tax has been paid to the state up front. And there were major changes in 2020 for large increases in vape sale tax, vape excise tax, in cigars and smokeless. Those aren't the documents I'm talking about, but they were looking for them. So they went in there, and there were many boxes, and they were the Department of boxes of materials that they did not have, apparently, at least on the premises, proof that sales excise taxes were paid. But I got that call because of the volume of product. So I interrupted my meeting, and I went to the store. And I don't know whether or not the board members have copies of the photos I took, but I had to do my due diligence because there were products, there's categories of products now that the law has come about. There's a lot of discussion about it, but I won't go into it too long, but there's what they call concept or on its face, not flavored, but there's suggestions that it is, and there's all different, there's difficulties in grappling about how to prove this or that. And many times, some of these products that some of the programs feel are flavored do have a document that certifies they're not. Perhaps the most notable one was when R.J. Reynolds gave a first iteration of a non-mentholated Newport, which had the same design, which was, I think, a little provocative or whatever, to a throwback. And now they're on that got pulled by the state. They said, we don't care that the document said it was flavored. We deem it is flavored through various testing. Now there's a new iteration of it. The products here were more explicit in their definition of being flavored, and I mean, I could go into the detail, but I think you have that.
Yes.
So I had to make judgments while I was there. I can't turn a blind eye to something like that. It's not something, Mr. Shaw and I have had a good relationship. There's been good attention to, deterring youth sales and such. But in this regard, there just was a lot of product, and many of them flavored. So that's why these correction orders were issued, sir. Okay.
I understand.
All right. This is, we're not making this a criminal offense, this sort of thing. It's just what the law has indicated is necessary. Now, and I don't know, I know I think I forwarded correspondence because the Department of Revenue, they take the product and they also make a decision on whether or not there's a suspension. It's kind of they approach things a little differently. Our structure of our regulations is largely fine. Theirs is essentially seizure and suspension, which the seizure is usually costly, because of the product. So if there's any, feel free to ask me any questions. I mean, as I reviewed it in regards to the suspensions, the board can consider a concurrent observation of a suspension unless you've appealed that. I don't know whether you've appealed those or not. No. So I'll let you speak to that. But the letters give a certain period of time. I think it's 10 days to appeal. But of course, the suspensions that have been issued by the Department of Revenue are longer than any suspension that would be, 30 would be the highest right now for us. And then I know I made note in the letter, and I have to only because there's a provision in the Tewksbury regulations that regard if something is, very strongly an affront to the regs, that revocation could be considered. These are all on your plate. Right. In regards, but if a suspension was something that that you had to decide on, there is a way to do it concurrently if you make a judgment that the 90 days or the 60 days, right?
It's 90 days.
One's 90 and one's
So
60.
they did provide, so this was a little confusing because there was a 30-day, there was a 60, and then there was a 90-day suspension.
Yeah.
So there's three different
60,
letters.
it depends on the product.
Yeah.
Yep.
The vaping was 90.
For all the different ones.
Yeah, for all the different ones. But in any event, I just wanted to, things can be done that way sometimes concurrently. Also, my only other thought, I'm not here to represent you, but for a tobacco-only store, for a convenience store and a liquor store, which would be the most common other business models for tobacco. Correct. They would remain open, but just not have their tobacco products available. In this case here, I'm just guessing, a good guess, that a suspension is essentially the closure for the store. So these are weighty things for you, the board, to consider.
Okay.
Any
So now I invite you to speak. I just need you to say your name and your address, please.
My name is Neetal Shah, and I'm the owner-manager for the tobacconist. The thing is that the product actually, I was not in America at that time. I was out of the country. We also have one store in Dover, so the flavor product actually came for that store. The new employee lady just joined like 3 days before I left. She opened it, and then when Megan, Megan, other employee, remove the product and put it in the container so I can take it, when I come, I can take it to the, send it to the other store. That was the reason we had a flavor product at our store. It was not meant for this store. And as far as the papers are concerned, specifying that this is not a flavor or any papers related to the compliance were there, but when you came, one of my employee was not able to find it because she was already like, what am I supposed to do? What am I supposed to do? While I was out of the country. Now with this 90 days suspension, 30 to 90 days suspension, we'll have at least 30 days I cannot open the store. Because cigars I can't sell it for next 30 days, and then I can't sell it. Cigarettes I don't care because I don't sell anyway. But and I can't sell the nicotine product for next 90 days. The next 30 days I have nothing to do, just to sit over there, because there is no other product I can sell. All tobacco products are banned from that day onwards.
You have, am I correct? You have pipes and stuff you can sell, correct? I'm just asking.
Yes, I can.
It's all a point of information. I'm just
Yes,
asking.
I can. That's like 2 pipes a week.
Right. I got you. Thank you.
Okay. So I have the pictures here in front of me, and unfortunately I don't have the plug to put it up there. So what I'm seeing here is the Cool Mint, the UNC vape, the Zyn, which is the
Yes.
licorice stuff. So that looks like it's all in it wasn't in a box, is that correct?
I took them out of boxes.
You took them out of the box, so were they displayed on, like, for sale when you saw them?
Okay, when I came there was disarray.
Okay.
Okay, so I can't tell you where things were. I just know that I met the agent that was there, and I thought he was putting things in boxes, but I cannot speak to, I can only speak to the fact that they were present there. And I don't know whether the Department of Revenue is aware of another, that by the way would be Dover, New Hampshire. Is that when you referred to Dover?
Yeah.
Yeah, Dover, New Hampshire. So this is new information to me. I don't know whether this has been presented to the Department of Revenue, but, you know, merely having them in the store, and I don't know how long they were in the store.
I just came like day before this thing happened, and we have a new employee. She's not really well versed with all the compliance to do with because she's normally been sitting in the evening time. So she opened it like, oh, we are supposed to open this thing. And in the morning, Megan came and like other employees said like, no, we cannot sell this. So she put it in the container and put it aside, all of them, to be taken over there.
Mike, so my next question would be, do you always have all your products shipped to the Massachusetts one?
No.
So why were these shipped to the
So
Massachusetts
the thing
one
is that
versus
the
New
person who
Hampshire?
actually delivered the product was not able to go to Dover in that week. So he said like, if somebody from this store is going to go there, which I was going to go because by the time I was going to come back. But it so happened that even before I came back, they did like, I told them to drop it over here, I'll pick it up and drive over there to the Dover.
Do either of you have anything else to add or would like to say before we make or does any of the board members have anything to ask or say?
I'd like to know what you think we should do, Ron.
Well, as you know, I have a long history of trying to remain as neutral as I possibly can.
Right.
Just let you know what all the, options are. I wanted to be sure I understood, though, are you going to challenge the, because the very same, you know what I'm saying, the same argument that they were just there for being New Hampshire would seem to be an argument to be made, because obviously you don't have the invoices.
Yes, that's right. The invoice was not kept with that because they sent the invoice directly to that store.
So you could show the Department of Revenue that.
Yes, I mean, I'll try to show,
But it's
and
okay.
some of them, I mean, but then they will remove the suspension for, I have 90-day suspension for nicotine.
Electronic nicotine, yep.
But the 30-day suspension for remove the smoke cigars, I can't challenge that because some of the invoices I'm not able to gather it.
Yeah, so I'm sorry, I mean, it's your
No, no,
question.
that's all right. You don't even have to
Because they
answer.
gave me the
You don't
time of
even have to answer
72
it.
hours, but I was not in the country. I cannot do anything in my absence.
Okay. Any other comments or questions from the board?
I just have a question. So what was the reason it was brought to Tewksbury and not,
Because he couldn't.
I just want to hear from him.
Sorry.
The delivery guy who goes to the door was not able to go over there because there was a breakdown in his car or something like that. He said, like, I cannot deliver it this week. I'll able to do it only next week. So I said, like, drop it at the Tewksbury store. I'll ask somebody to go over there, or if I come over there, I'll pick it up and transport it over there to the Dover store.
And it came without any invoicing?
Normally, they send the invoice over there at the store.
Without the
Yeah,
product?
so the driver does not carry the invoices because there were some discrepancies last time because driver misplaced the invoice. I mean, so in this, like, the whole product is bought on the basis of the volume. So higher the volume, different the price. So that's why they don't want the driver to show any of the invoices to other vendors, other retailers. That's why they don't give the invoice right away. So they either email me or they like, okay, I'll fax it to you. That's why I did not have those invoices at that time.
Okay, so I just wanted to clarify my question.
Yeah.
So when you get deliveries,
We
they
just get the
deliver, but
packing
you
slip.
do not get an order sheet to inform or say,
No,
this is
we do
what's...
get order sheet.
You do?
Yeah.
Okay, did you get one for this order?
Yes.
Okay. So it's similar, it's an invoice, but without the pricing. It's
Yes.
an order, it's your
Yeah. So
order
the
sheet.
driver only carries the order sheet. They don't carry
So
the.
you did have the order sheet
Yes.
accompanied the
Yeah.
one they dropped off? Okay. That's all I have.
Pam? Okay. All right, so seeing no further testimony, may I have a motion to
I
close?
make a motion that we close the administrative hearing on tobacconist.
Do I have a second? Motion?
I second.
Okay. The motion has been put forward and seconded to close the hearing. All in favor say aye.
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 Any opposed? I hear none. The chair votes aye as well. So at this point, we're going to deliberate. There's no more commentary from you. I appreciate your information. Okay. So from my understanding, there's a $7,000 fine.
Yes.
Totaling $7,000 within 21 days of the date of issuance. That's what's currently happening right now. So we get to decide if this was indeed a violation, which,
I personally think what's important is to see the packaging that was sent with it, because that would have addresses and where it was to be delivered. I mean, I think all that's important,
yeah.
unless you think it's irrelevant. I
It
mean,
doesn't matter what I think, it doesn't, I mean, we have, each one of us,
Yeah, so this is the
We'll put
part
a-
of the discussion where you can,
yeah.
George, do you have anything?
No,
that you
no, so
wanted?
I have to ask you the question, then, if you're stating that, what I'm trying to find out is, are you then, the only way we can do that is, are you saying to suspend this meeting to next month, and they produce that? I'm just asking.
no, I'm not sure. All
Okay.
I'm saying is I think we need to know for a fact that was sent to the wrong place. And so that's where I'm trying to figure it out, because in businesses that I know is, you don't deliver something unless you have the proper invoice or the proper order form for what you ordered and where it's going, accompanying that shipment. I don't know
I'm
a
not
business.
happy about the whole thing.
I'm
all I can tell you.
I don't think businesses do it any other way, but I could be wrong, and that's just what I wanted to discuss.
I would be questioning as an owner, but he's already said the reason why that they don't have that list or something, so other facilities
It
don't
doesn't
see
have
what you
pricing
order.
on it.
Yeah.
But it does have
Gotcha,
the
gotcha.
list.
Gotcha. I just don't know.
So there's three different violations, from my understanding. Well, two from the town of Tewksbury, and then three from the Department of Revenue, which basically was the cigar distributor without a license, the unstamped cigarettes, and then in Massachusetts, we can't have the flavored products. So the flavored products were there.
Right, but if I'm correct, not on display to be sold.
That's what I had, there's no known.
We don't know that because
The
we
intent
wasn't able
to
to find out from the thing.
So the whole
Okay.
thing is for the intent to sell in Massachusetts. That's where we get to figure out if there was an intent to sell.
Gotcha.
I just went, the way, because I wasn't there initially, but the issue of whether or not they're offered in the case is not necessary for a violation of 105 CMR 665. It says no person shall sell, distribute, cause to be sold or distributed, or offer for sale. So it covers for if there was any product on the premises. Because in the early on, if there was product on the premises, meaning when the state law first came into effect, we were provided some leeway because it was a big change. All of a sudden, if you had Newport cigarettes, they were not allowed. So we just told folks to put them in the back. But the coverage here does cover. It doesn't need to be. Frankly, I mean, in the cases where we have had sales of whether it be and 5% vapes at a convenience store, those aren't usually on the shelves. They're usually somewhere else because otherwise a routine inspection, depending on how thorough, wouldn't discover those. So
what I'm hearing is that even though whether an intent to sell or not, being in the store in Massachusetts is in violation.
and that's what makes this case tough, because it will be you weighing the testimony, and really, when you think of it, it runs the gamut from, I guess no fine to a lower fine to the most egregious of a revocation. So there's just so many different things for the board to consider as they weigh.
Steve, do you have anything that you'd like to say?
No, not really. This one is a complicated one.
Yes.
And yeah, I hear what Susan has to say, and I do think that would have an interesting bearing on this of whether or not it was erroneously shipped to a location. But it doesn't get past the fact that it was on site. So I think that kind of puts you in a box a little bit, unfortunately.
And that's where I wanted to ensure.
Well, I think it puts you in a box where I think the amount of money stays the same, but looking at how long or do we close, I think makes a difference. So I think if we actually, I think it would make a big difference.
But this was the Department of Revenue that's doing that, correct?
We only have.
Was there initially, yes, in doing the thorough
They're the ones that are
inspection of the
suspending
premises.
it.
I came in probably a half an hour after that.
They're the ones that are doing the suspension from the IRS, not us, not the.
Thus far, no. Theirs
Correct.
is a separate, and
That's different. We're unable to do anything with what the IRS is doing. So the point of this, like this discussion right now is, yes, did he have it in the store, which we have pictures saying that it was, so that's a violation.
Yep.
The other thing, so now it's the fee, which is also something that we get to state. So
I would say this, I mean, perhaps the most, boards always have to consider mitigating and aggravating factors. And you know the law, you know the presence alone is violative. However, perhaps the most important part of Mr. Shaw's testimony is if you're making a decision on, I think the wording is egregious, that would warrant revocation. And if there's a doubt in the board's, or at least if there's some doubt in the board's mind, that would sway them away, sway you away from a revocation. Because if there is, you know what I'm saying? Even if you believe, even if you,
we're going to do that.
even if the board would
Sure, we're going to not go revocation.
Yeah, no, but I'm just saying, I can't speak for every member of the board.
I know you can't.
So I'm just saying, in terms of making a determination of that was what was presented.
Yes.
And so if there was ever a thought, there was an absolute intent, to have these products there. Versus that would be, I think, perhaps rising to egregious. Whereas if it was, they would happen to be there due to error, then it would allow for the lower penalty phases. So, or somewhere in between.
Okay. Thank you.
Okay.
So would anyone like to?
I'm just, Steve, I just have a question on the letter that you have here. One of the things you wrote was their failure to possess, to possess the manufactured documents. So were you saying what was it they could not show?
At the time of inspection, they didn't have, Ron, can you help me with that? It was...
Oh, yeah, I'm sorry. Yeah, the documents, those ones that certify they're not flavored. Now, they wouldn't have those documents for the very things that were explicitly flavored. But there's one violation for having flavored. The other would be for not having the documents that prove that those that were explicitly flavored. There are sometimes some worded product names that get you to think that they may be flavored, I think in an intentional way, but they have a document to certify they're not.
Okay.
But these did not.
Are they supposed to? Or
Well, they
not
wouldn't be able to,
necessarily?
I'm guessing for most of these products here, there's, any of the ones you listed or have the photos, they wouldn't have a document. Yeah.
Product we actually sell, we do have the paper
Yes.
to specify. It's just that the lady at the store, the employee at the store was not able to, she was like already hyperventilating, I would say, because she messaged me late in the night over there while I was in India. So it was like, as I calm down, we will get the papers are there, you will find it.
Yeah, and by the way, those aren't the documents I was making. I don't usually with the retail community, I get to be very familiar with the products. Mm-hmm. So I'm not ever, this citation for not having manufacturer's documents wasn't for missing documents of products that I'm already familiar with, the fact that they have them. In other words, oftentimes I'll go in and I'll just say, yeah, I'll take a picture of them and I'll get the email or phone number and I'll say, just send them to me. So that way I have them, and then I'll do a follow-up. But your mere lack of possession of them is fine. Not fine technically, but to get you in compliance. That we're not here to fine for that reason. Here, because of the sheer volume of the product that was there at the store, you can't argue that there's a difference. Put it this way, if I just did one citation for the amount of product that was there, you normally would just cite, if it's just one product, if you had Newport menthols, that's a fine. Yeah. The question would be, you can't really issue a separate citation for another flavored tobacco. Do you count each flavored tobacco product? I try to use as caution and judgment and hold off on what this would be calling a stacking. I came in there and I would never cite for, maybe you don't have your license posted. Maybe you don't have a sign in place. This isn't the way the town of Tewksbury's tobacco control program works, and none of the programs I work with in the other 17 communities. It was just the sheer volume of the products that were there. This was, I don't know what the number is, you might know the number, but to say in the hundreds is probably
Even
not.
at this point, even I don't know, because
They took them away.
the order came and we didn't know that how much they took it away.
But although that would
Because
be
some were like old products, some were like new products.
although that would be on the invoice, so you probably got
Yeah,
an
I'm
idea.
just going through
Yeah.
it like what was
There were,
but
there was a
it's
lot,
hard.
there were many big boxes filled of
Yeah,
tobacco.
so a lot of product.
Yeah. I think that's why he called me, because
Yeah.
they wanted to have a knowledge, because oftentimes it's just that they don't have the proof of the tax, but because there were so many flavors, they
You
made
had
that.
to, yeah.
you know.
Pam, do you have anything to say? George, anything else?
No, it's funny, because I love this job. I feel like I'm definitely suited for it. But my only tough thing about this is, one of the reasons why I ran is because I think we have too much regulation in the state. And what I mean by that is flavors. I'm all for the state regulating the packaging, but I get frustrated about it. I think we live in a day, we got to stop. We just got to expect everybody to be adults and grow up and do what they're supposed to do. I'm ready to impose anything the other folks want to do. I'm not happy with this. And it's not because they can't sell products in this state. I'm actually frustrated that we've had to come to this point. I'll give you the other part of what I'm saying. I don't run a business, so someone can say to me, you don't know what it is to run a business. No, I don't. But you know what? You're taking the risk to run the business. You've got to get somebody in there that you trust to be there every day. Is everybody going to be perfect? No. But the thing is, you get rewards too. I'm very frustrated with this. I think we need definitely something. He has the ability to challenge at the state level. I'm more than willing to let him go through that process. I'm not happy. Whatever the board.
Okay. So currently
Let's
we
move
have,
forward.
so obviously the violations, so let's do this. Is there a motion on whether or not the violations did or did not occur?
Make a motion that the violation did
Can
happen?
we make a discussion on whether the violations did or did not occur?
Oh, it definitely occurred.
Okay. So
It was in the store.
I don't think we need do we need to do a motion?
No, I would-
Yeah.
I would basically just reiterate that that's a finding of the board.
That's a finding, right? So those findings did occur. So now it's the fact of the first amount of the 2,000, which is a second violation, and that's why it's the $2,000. And then on top of that, the third violation on the same day, which is the extended $5,000. So for the total of $7,000. And those occur. So now it would be implementing the fines and whatever else we wanted to decide on. And help me with this, Ron. The fines are the fines, correct?
Unfortunately, yes. There's no authority, but my only recommendation would there might perhaps be a decision on whether it reaches level of egregious or not, because that's a very important
The egregious
private
being the three.
property interest that Mr. Shaw has. So
The only thing that's a failure to possess the manufacturing documentation is just like my employee was not able to find it in this whole thing.
Okay, yeah.
Yeah.
And so you mean by egregious being the third?
the egregious would, because your regulations have something that regarded, if it's egregious, it would be subject to revocation.
Okay.
Perhaps whether
Okay.
for a discussion
So
on that first and make a
Yes, okay,
decision
so
whether
let's-
it rises to that level.
Let's
Because that's
discuss.
very
if-
important.
Okay, so let's discuss if that is something that we want to put a motion forward as far as seeing it as egregious or not. Correct? Okay. Anyone have any comments, motions on that?
We don't have much leeway as far as I can
Correct.
tell.
I believe that fine stand is.
No, the egregious, being that that's like the next step, right? So we need to see if that's something that we agree upon, that wording or not.
I don't agree with it, I'm just telling you.
Okay, so, Steve, help me with this, how
Yeah,
to
so
word
I'm
this
just
correctly?
thinking, I'm kind of thinking about this. So, I mean, George, you do not find this to be egregious, correct? Is that what you just said?
Yes.
Yeah, because we could, egregious could mean we could almost shut them down for
So
a year.
you
That's
could-
not, that's
You
not,
could actually, you could either roll that into, you could make a motion that you do not find the actions before you egregious in nature.
Okay, so let me put that in front of so do I have a motion that we do not find these actions egregious?
I would like to motion that we do not find these actions egregious.
Do I have a second to that? Okay, so there's a first and second on that. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So we are not finding that these were egregious. And now it goes to the point of the fines. So I would suggest putting, because the fines are the fines, doing the it's a $7,000 total fine. However, providing that he may or may not have 90 days of suspension per IRS, that we extend the time frame to, I don't know.
I would do the same as the last one.
or an extra 60 days.
An extra 60 days?
No,
Like,
They
so,
have
so
up
it's
to.
up to 60 days, same thing for the, even, okay. All right, do I have a motion for that? So do I have a motion that the $7,000 fine be paid on or before June 28th? I'm hearing no motion for
No,
that.
I'm going to motion,
June
I'm going to motion that the fine be paid before or on June 28th.
Okay, do I have a,
June 28th.
do I have a second for
Aye.
that? Do I have a second for that? Okay, so
I'll
there's,
second that, but I wanted to make a little bit of a statement.
well, it's
Yeah,
either,
no,
it's
okay,
either you
all right,
second or you
okay.
don't at
Yeah, I
this
make a
point.
second.
So, and I mean, if you want to change it, then you don't second and we can
No,
rediscuss
I have
another
no
thing,
problem
but-
with that. I just think we got to send a message, so definitely,
Okay,
I'm okay with that. I second the motion.
so there's a motion and second for the $7,000 fine to be paid on or before June 28th. All in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So it's been put in motion and set forward that by on or before June 27th, that $7,000 fine must be paid to the town of Tewksbury. Thank you.
And again, this is, I did suggest it at the beginning in terms of, did the board decide on concurrence on the suspension? In other words, since it looks like there are going to be suspensions already, rather than add on to
Okay.
it, you could have them be concurrent so that it wouldn't make a difference, the suspension.
Right,
That's
so
something you
it would be by the IRS, correct? Is that what you're?
By the Department of Revenue, yes.
Okay. Yeah.
So to be coincide with the
Yes.
Department of Revenue.
Okay.
I'm not saying that's my suggestion, I'm saying that I wanted to reiterate that
And not
that could be a
extend it.
and not extend it beyond. It could just piggyback on
Yep.
top of, I guess.
Thank you for catching that. I appreciate that. Okay, so do you want to have a discussion on that, or is everyone good? Does anyone want to put a motion in, or should I suggest one?
Please suggest one, because I was
Okay,
going to
so-
try to attempt to do it, but
So I'm going to suggest that we
Find the paper.
have the suspension in coherence and concurrence with the Department of Revenue.
I second that motion.
Well, I'm not putting it in, so that's just,
okay.
yeah.
Yeah, so just a question, like how many days are we talking for suspension? Would it be the same period of time?
Well, in your letter, you correctly noted that the max, well, the required, no, not the required, the max suspension would be 37 days. But your local regulations, again, have a range. So for your, since this is a second and third, the second could be as low as 1 day and as many as 7.
Right.
And for a third offense, it could be as low as 7 and as high as 30. So that's where the letter makes reference to 30, up to 37 days.
37 days.
But whatever it is, whether it be 37 or 8 would be the lowest, either one of them would be immaterial if they were concurrent with the Department of Revenue
Correct.
lengthy suspensions.
Because they have the 30, the 60,
Yeah.
and the 90.
Yeah, I suppose,
Okay.
yeah, yes.
So we don't have to specify a number of days specifically, just say,
Whatever the length is, in that if you decide you would like it to be not added on, like after those suspensions or before those suspensions take place, whatever number it is, it will just be merged in.
So I would suggest that that a motion be placed that is concurrent with the Department of Revenue being the 30
7.
days. And so if it's the 30 day, because they have a 30-day suspension of the cigar smoking, so I would do the up to 37 days, so with, not in addition to what the Department of Revenue is already doing. So not an add-on.
So I'm going to try this one. I would like to put out a motion that the fine of the 7,000 is,
We already did that one.
no, but you want to make it concurrent.
This is
No, this is for
suspension.
the suspension.
Suspension.
Okay, I'm sorry.
So we already did the
All right.
7,000, yep. So now it's the suspension. Do we have a motion? Anybody? Anyone? Any motion? We need something.
I'm just going to, all right, I'm going to just ask some questions to understand. So we have different departments that are, you have the Department of Revenue that's put how many days on them to be closed?
So there's 30-day suspension of
days.
cigar,
Yeah.
smoking tobacco.
There's 60.
Then there's 60 days of cigarette, smokeless tobacco. And then there's a 90-day electronic nicotine.
Right, that's all from the Department of Revenue.
Correct.
And that's happening, correct?
Yes.
Okay.
That is something that if he wants to,
Fight it, you can.
it would be with the Department of Revenue. That has
Revenue.
nothing to do
Okay,
with us.
But that's happening because of all these,
Correct.
okay.
Yes.
So,
And we can do a suspension up to 37 days.
all right, well, I think the 7,000, to me, I feel that that's fit because he's going to be shut down for some time, whether it's 30, 60, or 90. And I think between the two departments, he'll get his act together.
And that's why I just want, I think you're on what I predicted might be a wavelength of having it concurrent. If you do concurrent, that means that really the Board of Health just is
meshes
together
in,
with it.
right?
It doesn't
Meshes in.
add to it. It's literally
Adding.
alongside.
But it's just in concurrent.
Yeah.
And I don't think it matters.
we already voted, yes?
No, we didn't vote.
No, we
There's no
didn't.
motion, so we need a
Okay.
motion on the board. I mean, on the table. So,
Oh, why did I think somebody already did that?
no, there is no motion yet, so feel free.
I just think it's confusing because we're meshing in, we're not adding anything.
Correct.
It's just that we're sharing the time with another department.
Yes.
So to me, I think that's ridiculous, but whatever.
I just need I can't do a motion, right? I can't do the motion.
It's rare to have a
Yeah,
chair to do
so
this.
I just need a motion on the table.
Okay, so what if,
Is your intent to not, you don't want to add on any more days than what already the Department of Revenue is doing, right?
exactly.
So if you
But-
do use that word concurrent, and whether you say 30 days, let's just say for the sake of argument, you said 30 days, that 30 days, if,
It'll
let's say,
mesh.
it'll mesh. So what you would be saying is it lines up. So day one is day one of your suspension and the
Yeah,
Department of
it's-
Revenue, so it doesn't add a day. So
We're not
it's
adding
it's kind of
I
a
know.
weird.
Okay,
Unless you want, I mean, there's
No.
always, this is part of the discussion, unless you want to say that you can always put a motion that
Yeah, because he could.
there is no suspension for us. Like, we're not adding a suspension, we're not doing it. So you can do in concurrence or
We
no.
have a choice to not do a suspension? In the health?
Not
No,
really.
We don't
No,
have a
right?
choice. But we can make
Yeah.
it
at
concurrent.
least a day.
You know,
It's the days, it's the
One
minimums. We
there
have
are
to do a
minimums for
minimum.
both of them. And I was kind of wondering too, is if he appeals the state
Right.
and wins,
Right.
then his suspension, he wouldn't be facing a state suspension.
Now, Mr. Shaw, have you appealed, though, the Department of Revenue? Because it says you had 10 days from the receipt of your
So by the time
correspondence.
I was not able, I just came day before yesterday from India, I was not here.
Okay.
Okay, so I was not able to appeal those things.
Okay.
And there is nobody in my absence can go and do it.
So
But we have to
basically,
say a day, like we can say.
We can say
That is,
concurrent.
I've
For
already
one
asked for
day
those things.
to be concurrent with the
But you're gonna
balance
try to
of
appeal it
whatever the
anyway.
I'll try
revenue
to,
was
gonna appeal it
suspended.
anyway.
yep.
Okay, well, that's
We,
simple enough.
yeah, it's the wording. We can say, because it's up to.
So I would be
So
happy
our
to make a
verbiage
motion.
is up to 37 days.
Okay.
So we can do up to 37 days. We can do less than 37 days, and I
Do we
believe
need
it's-
to make two
No.
motions? Can we just make one motion
One
that
motion.
says, okay, I'll make a motion?
Okay.
And if it's not worded correctly, someone will correct me. I'll make a motion that we suspend for one day, and we have that suspension run concurrent with anything the Department of Revenue proceeds to
Move forward with.
go forward.
Okay.
There you go.
So we have a motion on the floor to suspend for one day in concurrence with the Department of Revenue.
And I will second that.
Okay. Motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So we'll suspend it for one day in concurrence with the Department of Revenue and move forward from that. That's good? Okay.
For everyone's patience. It was very.
Thank you.
There was a lot
Worked
in
very
there.
hard.
This was a complicated one, so I appreciate your time and going through that with
Thank you.
us.
Thank you.
Thank you.
You're very welcome.
Okay, moving to the next. So we're now going to move to Jimbo's Roast Beef and Seafood at 616 Main Street for compliance review. So if you can come in front of the board. So I'm going to entertain a motion to open the compliance review for Jimbo's Roast Beef and Seafood at 616 Main Street.
I make the motion that we open the administrative hearing for Jimbo's Roast Beef and Seafood.
Okay?
I second.
Motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. Okay, so this item is, I'd like to actually, Steve, would you like to go through, or do you want me to? I have like a little summary, but I figure you probably would be
Let's
best.
see where to begin.
Yes.
So, obviously, we've had some issues in the past with inspections at Jimbo's, and I think kind of what put us on the current path that we're on right now is that the health director went out and did an inspection, I believe it was January 23rd, I think, and then it was followed up with an order of January 30th. There was an agreement that you would hire a consultant to help you work through these issues. They did hire a consultant, and We received the 6 reports from the consultant within the last few days, and I believe that Siobhan was out there last week with our food consultants that we're using ourselves, and she had there were some findings that they had that.
Just little things.
Yeah, but there's a request or a belief from staff that we should continue to monitor over time, so that's kind of where we're at right now. And I think we have provided to the board, Siobhan did, her thoughts and comments as to where the board should go next, so.
Yeah. So there was a full inspection, and then the findings, which I believe are still similar to the ones that were from prior. So if you just write your name and your address on the form. Is there not a paper there? I apologize. Here you go. And then state your name and address, and then the floor is yours.
Go ahead. Kirat Singh, 20 Pratt Street, Tewkesbury, Mass.
Can you repeat that, because it was off at the beginning? Thank you.
Oh, it's outside. Yes.
No, it's fine. It's green.
Harkirat Singh, 20 Pratt Street, Tewkesbury, Mass.
Okay.
Mohit Sani, 36 Joseph Smithway, Boxford, Mass.
Okay.
All right, you're a neighbor of mine. I'm on Pratt Street.
So would you like to comment, make any comments?
Sure, ma'am. I feel like we're doing much better than before. We're still improving as our consultant recommend us whatever she says, and we try. And we'll continue that and make it perfect the way Board of Health likes to see. And we're trying to find the best person to be there all the time who can keep an eye on it. Things like the staff can follow all the directions and plans that we can put to continue for the safety and cleanliness. And we're making some changes to, like, we have a limited space, so we're giving a lot of thoughts how we can manage and what can we do. So we're still working on it to make improvements.
Would you like to say anything?
Yes, so the health inspector, and we had inspection a couple days ago, and so they mentioned that we have to change cutting boards. So all of the things we have ordered, and our food consultant has emailed the town that these things are already ordered, and she ordered for us everything that needed to be done. She said that I will send the email.
Okay.
Oh, she just want to make sure that you receive the email that everything she ordered, and we are on top of that, because in a business this is our first priority, to make sure everything is nice and clean, and we are doing that to maintain everything with that, with the town and the health inspector. Everything is.
So from what I'm seeing here, a lot of the consultant has been with you for 6 months. They worked with you directly. And there's still a few things that haven't been addressed by management. So do you have a manager on at all times, or is it, do you have like a person in charge?
So, ma'am, our business is a family-run business, and one of my grandmother, she takes fusion therapy every morning, so my uncle has to be there and all the time. So these are the things that, so it's a family, a little bit time, but we are trying to find if any of us is not there, she'll be there or he will be there. This is what we're trying to find out.
A person in charge?
Yes,
like
because our kids, they go to school, we have to drop them, and so there's a time that we have to make sure that the place has been taken care of. But we are, every day, we are 7 days working there all day, and just in that time, so this is what we are.
We do have a person, but I don't think is strict enough or good enough, so we're trying to find a better one. So that's what we're working on. Somebody who's really tough, can make people do things or inform if it's not listening.
And from my understanding as well, there was, whoever they asked when they were there, they weren't certain on specific codes. Is that correct? From my understanding from,
So all of our employees.
80 to 90% of our staff is ServSafe, and we train them well. But you need somebody like manager type to make sure they follow all the rules, and otherwise they don't do, unless you tell them to do it, and they don't do it.
yeah.
They don't do like good training then.
So all of our staff, after a couple months of waiting, we try to get them certified from ServSafe, and we had a meeting on last week, and we are waiting for their certification to come. So we try to invest the money to every single employee to be trained and to understand the food code. So the problem we are having, so some of the health inspector came that we have a lot of stuff they are ready to use. We don't prepare in advance, so we are ready to use. So that was just, we were lacking on some of the information. But those things are ready to use. We don't use like all day long because.
Okay. Would you like to add anything else or before we, does the board have any comments, questions for?
I just want to clarify a few things. Totally understand you're open 7 days a week. So you don't have, right now, you don't have someone that you're comfortable with that can be there the whole time you're open, that you feel safe by, they're going to walk around and make sure everything is done the way it's supposed to be?
So ma'am, we are a family-run business, and we used to try to open it like nighttime, but we stopped that because hours were getting long. And due to the family emergencies, so sometimes we have to leave the store, but we never leave it without, from open to close, we never leave it. But due to grandmother sickness, we'll try to find in the meantime that we trust and that can communicate. And
Mohit's father used to be there. He's in India right now. He's coming back next month. And again, the person we have, he's good. He's a good cook. He keep an eye, but we need somebody strong personality who can take action and tell us. And
Well, no
they
one's
become
gonna do it
friends.
like an
We don't
owner.
need a friends, you know. So eventually we're working on it. We'll find somebody who can do a better job than what we have right now.
George, do you have anything?
No. My concern is that compliance is what we want. But, and you know, I call it's like a balancing act sometimes, okay? So we make judgments and we look at the situations. We want compliance, but my thing too is, again, I have to think about the people in the town that are going to go there. And if somebody's there, sometimes that's cannot make a real, like a management decision or something. I mean, what happens if it's something about a fire? What happens if it's about something about food that somebody gets sick from? I want compliance. I think we're on the right road in this instant. And so, again, I'm willing to go with what the board decides. I can't, what I'm basically saying is I cannot feel, I don't know the word I'm looking for, but I can't feel the concern all the time of people that own the businesses and looking for people to work today. That's part of what you do when you take that risk. I'm concerned about the people too.
Thank you. I get it. Pam?
No,
Any questions?
I don't.
Any comments? Okay. So with the consultant, now it's over, what is your plan of, I guess, I mean, I think for us, we're gonna kind of discuss and do some things of further action and discussion for what we're thinking for you. because the goal is, again, compliance and not having continuation. So I think there's some lack of, like you mentioned, having someone that is there, and whether it be you or whether it be someone else, I mean, that's part of, again, being a business owner. Unfortunately, not a lot of people want to work well and don't work as well as the business owner because you have the collateral in there. No one else does. And it's, you know, I actually just went to a thing, and this is off the top, but entrepreneurship, people who own small businesses, they don't earn a lot, and it's not a 9-to-5 job. You know, we don't earn, like, small businesses don't earn a lot of money, and it is not a 9-to-5 job. So we don't do it because of the money. We do it because we like it and we want to do it. And so that is something that is a responsibility of the owners. Okay. Do you want to add anything else before we shut the portion, which would then be no back and forth? It would be just us discussing and deliberating.
Yes.
Yes.
I live in town, Mr. George, and I go there at least 3 to 4 times a day to my restaurant. I own another business in Lowell. I have to go pick up, my kids go to school in Greater Lowell Technical High School. I have to pick up, drop in the morning. So between those times, I can't be there. So those are the slow times, and I need somebody can force all my staff to make sure they do, otherwise that's where the issue is. Other than food, cooking, we keep an eye on every single thing, perfect, and make sure it's safe.
I
And
see what you got to deal with.
last 17 years, we never got anybody sick.
Right.
We are in business because a family, my wife goes there, check on them when I'm not there. His father comes. So we're a family. It's not like we just open a business and we leave and it automatically, no, it's not like that. I love doing that. That's what I'm doing that for 17 years. It's a tough business, a lot of long hours.
Yep.
It takes all my energy, but I enjoy it. I'm a people person. I love to see you guys when we come there, you know. So it's just matter, I needed somebody who can strong, so we'll be good, I think. Shouldn't have a
We
problem.
are working to,
I'm
my
looking
father will
forward
be
to it.
back next
Yeah.
month,
Looking
but
forward
in
to
the
it.
meantime, we are making sure.
And we're
we
not
are-
going anywhere. We love this town, we love this business,
Yeah.
and we'll be there.
Yeah.
And we'll fix it good.
And I think it's,
Thank you.
and I think it's important to, when you know that someone's going to be away, planning ahead. I mean, that's part of, you know, it's forecasting what may not happen. It's all part of, and yeah, things don't always go as planned, obviously. So the important thing, so what this is basically saying that these, what we're going to, you know, once we close this, is discussing like these violations or these findings are in fact findings, and then what we're going to plan ahead for as far as what we're expecting from you moving forward, and if that does not occur, what the implications may or may not be, depending on what we decide as a board.
Thank you, ma'am. And whatever the health inspector shows us, and we are willing to fix it right away.
Okay.
So we won't, so one question, because the question that health inspector has was about the raw eggs that we use homemade house dressing. So it's not like we make a lot, we just use for daily use. So that's where, like, and we've been, since the day we opened the business, that's what we've been doing. So she was concerned about the raw eggs in the dressing, but we don't make a lot. We just make for daily use only.
Okay.
Our house dressing,
For
Greek
the house
dressing.
dressing, yes, ma'am.
So Greek
Yes.
dressing, when you make, you put raw eggs,
Yes.
and the health
That was-
inspector has a concern that it can, it's either be pasteurized or you can't use raw.
Yeah, but
Correct.
we don't
It's
make
raw
it a
eggs.
lot, like for the, we just make every single day.
Small portion.
And a small portion that we make it through the day.
So can I just ask you,
Please.
that small portion, it's refrigerated because it has
Yes,
the raw eggs?
yes, ma'am, always.
And it has your date on it with the label?
Yes.
We do
yes,
for
ma'am.
daily use, we use it for daily use. Every morning, when we go open the store, we make it for daily use. We don't-
Again,
Okay.
Our prep guy comes in like 5 in the morning and he does all fresh salads and everything. And he's, the day we bought this business, last 17 years,
It's the same guy.
same guy.
like,
And he's there, his kids owns a restaurant and they're begging him to work for the family. He said, no, I'll work here. So,
So anything else that we want to discuss before we close this portion? All right, do I have I'm hearing none, so do we have a motion to close the hearing portion of this?
I make a motion that we close the hearing.
I second.
So there's been a motion in place and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. Okay, so now we go into discussion and C. So I don't know if you had seen the recommendations or what the findings were, but I can go over them with you if you'd
Please.
like. So the consultant invested multiple hours working directly with the owners, person in charge, and provided detailed recommendations. So from the 6 reports, these were the things. So ceiling vents above the walk-in cooler freezer were observed with heavy dust, soil, and grease accumulation. So it was not addressed by management and still present on the May 12th inspection. The aprons were observed on top of prep tables and below shelvings, so that wasn't addressed. Floors in the walk-in freezer were heavily soiled with more than 1 day off food and debris accumulation. I think that means of food and debris accumulation. Cleaning chemicals and cleaning supplies were stored directly on the floor, and a bottle with cleaning chemicals was observed on the counter, which was not labeled. So they were using the consultant Mogens, which is a risk-based inspection, and they prioritize critical violations. And so these are why some of their observations from their reports were not here. So these are not heavy violations, but they're not critical violations, but they are still some findings. So there are some recommendations. And we can go one by one and kind of put, and then if we want to put a motion for all of them or do individual, we can probably do that, or it might be better to do individual. Yes, okay.
Yeah.
So first one was correct all outstanding violations no later than May 21st. So that would be,
Next Wednesday.
yes.
Those were the outstanding violations from the May 12th inspection.
Correct. So the outstanding violations, so those 6 from May 12th, which were the ones that I just went over, would be corrected by May 21st. And then address unresolved items from the January 30th order letter, which is person in charge must demonstrate proper sanitization use, and the Ecolab wall dispenser, if the Eco-Wall dispenser is no longer in use, it should be removed to eliminate confusion. So there was that wall dispenser, which according is no longer being used, so that would have to be removed, and then have a person in charge. And then prepare schedules for cleaning, which the consultant actually prepared one. So I'm assuming that they're going to be providing that for you, which is a cleaning for daily, weekly, and monthly. Another one was the person in charge identification and responsibility, which is something that to formally designate a person in charge who's going to be responsible for compliance, outlined in the food code. So a secondary person in charge must also be identified to assume responsibility in the absence of the primary person in charge. So that's basically to negate any type of, this person isn't here, so that's why everything went sour.
I'm definitely for that.
And so having designated 2, and that there's always one of them on site for a designated amount of time at the discretion, and it could be a discretion of the board.
Correct.
And that would be, we can decide on how many hours being of operation. There's the ongoing oversight by the health department. So basically periodic inspections that we can recommend, and it could be determined by, at the agent's discretion, but we can start it weekly until knowing and then moving forward, or something else. And then also coordinating that with the person in charge. There's also the consultant involvement, so continued engagement of food safety consultant. I believe they had mentioned that they were willing to retain a consultant voluntarily. So, you know, even though they've had 6 documented visits, there's still, you know, issues remain unaddressed. So that's an issue for concern as far as compliance and continuation of that. So that's something that we could consider. And then I think it's important that we deliver really clear, concise, like time frame wise. So doing really kind of like a SMART goal. So it's you have the time when it's due, and then anything that is not done after that time frame, what the repercussion is going to be, so that there's no ifs or, you know, this is what's happening. We already kind of put that in standard motion. So there's that. So like we can exercise the authority to suspend a food, you know, license or something like that.
Correct.
So it doesn't mean that we would, but we can put that as a condition to
Correct.
if things are not done. And I think that when we do our date, we can do that they are, they may be required to appear before the board unless otherwise decided by, you know, depending on their compliance. So those are the things that were recommended. We can go one by one and kind of discuss, and I think that would be really great to, and then say if we want to put a motion in, if we agree with it, and then do that. What do you guys?
Well, all of these are from the same source, the same reason. So I think, I mean, if you want to go one by one because of understanding, you can do that.
Yeah.
But which is fine, but I'm looking at it and I'm saying, there's 2 things that come to my mind. One is the consultant that they have, that they're talking about having again, isn't helping with these day-to-day things. They're only helping with the big things.
Yeah, and that's what they focus on, the
Exactly.
the major violations.
So,
yeah.
which is fine.
The
But
critical.
these things are critical too, but they all fall under having someone present at all times.
Absolutely.
So there's businesses that would close their hours. If I don't have somebody that's in charge of my business and that I'm comfortable walking away from, then I'm going to change my hours. And that's what I did. So I accommodated it so that I knew that when I'm not there, I'm comfortable that the person and the second person are on the schedule to work when I'm not there. So with all of that said, I mean, if you want to go one by one, that's fine.
What I meant by one was basically the recommendations, not
Yeah.
one by one.
No. Exactly. Yeah, okay.
Yeah.
Thank you. As I went off.
Yeah, no, that's what I mean. So,
But yeah.
Sounds like she wants to make a motion to put them all together.
No.
I think, yeah, I
Let's go.
think
We
just
can
for,
talk.
and we can talk for each one. So let's say, so all violations documented during the inspection, so the first one, and we can put a motion in, or we can change the date, whatever you guys want, like there has to be some type of motion, but on the premises of all violations documented during the inspection on May 12th, which are the 6, must be corrected no later than May 21st, so on or before May 21st.
I think that's reasonable.
Okay.
That's
None of
that's
those
good.
are
So,
like-
ma'am,
It can be done in next 2 days.
Yeah, so
Yeah, none of those-
So, yeah, so this is, and this is something that we're deliberate, so I appreciate you guys trying to chime in, but this is like, so we're just kind of discussing it, and
Sure.
if you can do it in 2, great, so that would be on or before.
It'll be done then.
So we can't have the discussion back and forth because it's already been closed, I apologize. So is there a motion, because we just want to get the motion on the floor, so is there a motion, can I have a motion to have all the violations documented on the inspection on May 12th to be corrected, must be corrected on or before May 21st?
Can I just have something to say
Yes,
prior?
yes.
In order for those to be completed and done, then you need to have a schedule of who's going to be in charge, because right now they don't have anyone in charge.
That doesn't, at
No.
this point, it doesn't even matter. I
No.
mean, I personally think that's all the other things that get to be resolved, but those violations, whether they have a person in charge or not, need to be, I personally think, whether it's them doing it or someone else doing it, needs to be.
I'm just thinking of the bigger picture, but.
Yes,
okay.
I know what you
That's what
mean,
we're
but that's
thinking
where
about.
that's where we're gonna go with the
Okay.
next
All right.
recommendations. Does that make sense?
Yes, it does.
Yeah. So there's been a motion on the floor, no, can we have a motion on the floor for that?
Yes, I will make a motion that all of the violations from May 12th be completed, corrected by no later than May 21st.
Okay,
I second that motion.
all right, motion and second on the floor. All in favor, say aye.
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 Any opposed? I hear none. Chair votes aye as well. So for the record, the violations from the 12th, so those 6, they need to be corrected on or before May 21st. So, okay, that's the first one. Second recommendation was address unresolved items from the January 30th order letter. So that was the person in charge must demonstrate proper sanitization use, the Ecolab wall dispenser, if it's no longer in use, to be removed, and then prepare schedules of cleaning daily, weekly, and monthly. So my suggestion would be that so starting as of tomorrow, they are preparing the schedules for cleaning daily, weekly, and monthly, since their consultant already provided them one, and that is to be given on a monthly basis, or like it's provided when asked for, but submitted monthly to the, can we do that? Submit monthly to the, you can say something about that.
We could do that. I think it would just be a little bit onerous and cumbersome for people. So it's more of, it needs to
Just
be
them
in
doing-
place
okay.
so that when we do an inspection that we
Yes.
see it.
Okay, so that there is the daily, weekly, and, so daily, weekly, and monthly cleaning schedule in place, ready for visualization if an inspection occurs and it's asked. So that's starting like as of tomorrow. And then the unresolved issues from January 30th, I would suggest having a date of when those need to be compliant. So that would be demonstrate proper sanitizer use. So that's the person in charge. So for that, let me think here, because now I'm looking at the next one. Formally designate a person in charge. So that would probably go first, I would think. We can discuss this. So number 3 is like formally designate a person in charge who's responsible for compliance, and then the next one, like the number 2, would be that person demonstrates proper sanitization use. So there's those kind of combination.
I think that's doable. I think that they can look at their staff and look at its family restaurant, so you have a lot of family that, hopefully, that are involved. And you look at it and you say, this is what we have to do.
Okay.
And you do a schedule
Yep.
of the people you know and you trust that can go on that schedule and be there.
Yeah.
And then you have a secondary if
Yep.
they're not there. That,
Yes.
I'm sure they can.
Do we
have
want to have a time frame for them to be able to identify that
that.
person?
I think they should be able to do that like within 3 or 4 days.
Okay, so you want to give that, do you think on or before May 21st? Same date?
I
Do
think
that?
so, yes.
Okay,
And then they can still continue to look
Yep.
for that person that they want to put in
absolutely.
charge.
And then with that, do we want to put in a designated amount of time that that person in charge needs to be in the establishment? So more than half of the operating
It
hours.
doesn't matter as long as they, on the schedule, it shows a name of someone who they trust that is there
At all times.
at all times.
So it'd be
It doesn't have to, it could be different people,
Okay,
but people who are capable
so
of-
we would want a person in charge throughout the,
It must be for the
one
entire
person
day.
through the entire operating hours. Okay.
That's the normal.
Would you like to put a motion
code.
on that then?
I'd like to motion that they have a person, could be multiple, but have a schedule that lists a person there for the PIC the entire time that they're open. And they have until the 21st, which I'm sure they already know in their head. what's
Okay.
going
Safe
on.
certified.
They would be safe. All the people that are main people there are safe certified.
Okay. All right,
We had
thank you.
a-
Yeah,
we
person
had
in
a-
charge. Yeah, the
Most-
person in charge, I
We had a
believe.
80 to 90% of our staff
There's-
is
there's-
certified.
And
So the
cleaning
person
we
in
take
charge
very
is,
seriously.
they need to have that. Yeah,
We're not going to leave it to the only
okay. So,
in charge of person. We're going to keep an eye on ourselves. We are tired of this. We want to.
okay, so there's a motion on the table that on or before May 21st, there is a person in charge on the schedule throughout all operating hours, however many it could be. It could be 1 to 2 to 3, however. There is always a person in charge on the schedule throughout all operating hours in which that person must demonstrate proper sanitizer use. That's the motion on the floor. Do I have a second for
I'll
that?
second that.
Okay. Motion has been put forward and seconded. All in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well, so that's putting in place. So on or before May 21st, there is a person in charge on your schedule at all times, and they are able to demonstrate proper sanitization use. With that being said, I'm just going to, that whole Ecolab wall dispenser, that's something that you already know about. Okay.
And I just want to add that what we just put in motion is what it's supposed to be at all times.
Okay.
Anyway.
Perfect. Even better. Next would be ongoing oversight by Health Department. Do we want to put that in motion as far as periodic inspections with the person in charge present? And that can be at the agent's discretion, or we can start it off as weekly and then at the agent's discretion adjusted by compliance.
Can I
Go ahead.
suggest that, because they're going to have these things done by the 21st, can I just suggest that we check in on them like once a month? Because I know it's like once a month for a while until we're comfortable. What do you, or
Yeah.
if they're in compliance, just wait for the next inspection?
Weekly may be better right now.
Yes.
And I don't think that that's a heavy lift between us and Mojins, who's doing the inspections for us, to try and get in there. And then, again, that kind of keeps our eyes on the ball,
Yes.
and it also is there for you if you have questions. So I think that would,
That's fine.
I agree. I would suggest weekly at first, and then be it based, with adjustments based on compliance, based on what's being completed, and if there's, an education needs. I think that weekly would be, at least to start, would be beneficial. And then, that would be, the consultant would be at the discretion of us as well. So let's go with the health department first. Do we have a motion? Would anybody like to put a motion to do the weeklies?
I would like to put in a motion to have the health department do weekly inspections.
Okay, so there's been a motion, and correct me if I'm wrong, motion to have the agents do weekly inspections with possible adjustments
Yes.
as far as based on compliance. Do we have a second on that?
I'll second it.
Okay, so motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. So that will be, you'll be hearing from the health department on that. Next one is the consultant involvement. So we can, we can, it's at our discretion as far as if we want them to continue with the food safety consultant, but they have also said that they would do that voluntarily. So do we want to continue with the consultant? Is that something that we want to put on the board and do that?
I don't know, it seems to me if they comply with the inspections and the timetable,
Yeah, I
they
don't,
may not find that they need that any longer, but then it would be addressed again in the future if it needs to be.
I think that's good for them to just go forward with what they want to do with their consultant, because I'd only say if they don't comply, again, I think if there's a non-compliance, the only problem at that point is I'll be recommending that we get a different inspector. I mean, a different consultant. Thank you.
Okay, so,
I think everything's fine.
so do we want to just do it, that it would be at their discretion? The only thing that was mentioned here was the consultant may be best suited to train the new people in charge once they are designated.
But do they train them? Because they don't do the smaller things that are really important.
Okay, yeah.
That's what it concerns me.
Yeah,
You
so
know.
I mean, I wouldn't be
These
able
are
to speak on
hour
the
to
consultant,
hour,
yeah.
You know, I get a sense that with our engagement being more frequent, that the consultant may not be necessary. And at this point, it may be worth leaving it to
Them.
them to
Correct.
decide how they want to handle that.
I
Okay.
completely agree with Mr. Stephen.
Yeah, so if everyone is okay with that, and we don't want to put a motion on the floor, we don't have to. And what we can go into, repercussions for non-compliance. So I think I would suggest a motion as during any scheduled inspection, that there is, any findings or anything has not been met, the agent can exercise their authority to suspend the food establishment's permit on site without requiring our approval. So they wouldn't have to necessarily come in front of the board. They can actually suspend it right there on the spot. That would be something that we could state, or having them or there's also the recommendation that they can be required to appear before the board. Yes.
If I understand the codes correctly, I think that the agent has the authority to do that already.
Already.
But I don't think it hurts that in this circumstance that you just reiterate that
Yes.
they have that authority, that if they find something, they can suspend and shut it down.
Correct, without,
He looks like he's 50, and I wish he'd stay around a little longer. Don't you? I mean, the verbiage is the important thing, and he knows his
Yeah.
stuff.
So, I mean-
I'm in total agreement with that.
yeah, and I think even if, they can do that, and if they choose not to, I think one of the things, if it would be, if they are required to come before the board again at a future date, then we also may exercise the right to suspend their permit. So I would like to put a motion to kind of reiterate that, so that it is, so if anything, any repercussion for non-compliance or continuation of non-compliance would, the health department or appearing in front of the board could, the outcome could be maybe why am I confusing my words? Suspending their permit. So that would be my suggestion.
I'm trying to word it. Is anyone going to help me with this?
I'm only not doing it because I don't feel like, I mean, I know it's good to do it, but I just think everything's going to be taken care of.
Yeah, I do too, but I know we have to
Yeah.
do this, but I don't.
Formalities, yep.
Formalities.
Do you want to put a motion?
So I'd like to put into motion that if a future inspection is done and there are, my mind's going blank.
Violations,
And there are repeat violations and non-compliance that they may have to come in front of the board, who would have the ability to close the restaurant for a certain amount of time,
suspend their permit.
suspend the permit.
Impose some suspension.
Thank you.
Okay. So there's been a motion, I'm going to kind of
Yes.
reword it a little bit, that the health agent or appearance in front of the board has the authority or may suspend the permit if there are continued non-compliance or throughout the defined timelines given. That's the motion, correct?
Yes, it is.
Okay. That's been put forward. Is there a second to that motion?
I'll second that.
Hold up a second.
Okay. Motion has been put forward and seconded. All in favor say aye.
Aye.
Any opposed? Any opposed? I hear none. Vote chair's aye as well. So that has been put forward. So just so you know, by those dates, those are needed to be done. If not, they can suspend your license, the health agent, and does not necessarily need to come in front of the board for that. The last one would be if we want to have them appear in front of the board within a certain amount of time, unless otherwise decided based on compliance. Do we want to do that, or do we want to just kind of go with the flow?
No, I'm in favor of if they continue to comply as far as the inspector is considered, they wouldn't need to before.
Correct, I agree with that too.
Correct.
All right. So that has been done. Thank you for your time, I appreciate
you.
that. If there's, the health department will send you all the information too, so that you have those deadlines,
Sure.
but just so that you're aware. Appreciate your
We
time.
will try hard to make sure
Yes,
everybody follow the rules and nice
get those
and
people
clean.
in charge.
We have, doesn't matter who we make in charge, we have to keep an eye on them, otherwise they don't do. That's
Absolutely.
what we learn.
Yep.
Thank you so much, I appreciate your time.
Thank you again.
Thank you.
Okay. Thank you all. All right. Next item on the agenda, if I can find it in between all my papers. Oh, here it is.
Fees schedule.
The amendment of the 2025 fee schedule. So there's some housekeeping and policy updates. So there's some adjustments. So under the body art apprentice, the wording first 6 months, it's proposed to be removed. So this is to clarify that apprenticeships can continue for up to 2 years, but all permits expire annually on December 31st, just as they do for licensed practitioners. So that would be the first.
Wasn't that done?
That was in the actual regulation, but on the fee schedule
the fee
itself,
schedule
it's
has to
still
be
on there.
done.
So we
Thank
need
you.
to put a motion for that revision. We can do propose.
No, I think we should put them all together.
All together, yeah.
Let's do that.
So that's the first one. The second is all the references to the Sharp collection fees are proposed to be deleted. The health department no longer charges a fee to collect those Sharps, and so this change aligns with the fee schedule with the current practices. So everything that is in green that you see on this paper. So those are the proposed. Are there any other questions or edits that we would like to make to the fee schedule? I do want to put in that I did look at some of these fees compared to other places. We're pretty much on basis with other places. Some places are a little bit higher here, a little bit lower here, but we're pretty average on surrounding towns and cities. So.
I wanted to make a proposal, but I prefer to speak on it, on the smoking fee for those that sell tobacco.
So, yep, the tobacco
Yeah, the,
sales. So currently it's 150.
Right, I mean, Steve could speak on it, but some of the surrounding towns have 200.
Yes.
So I'm going to
notice.
make a motion to increase, but would anybody want to speak on any of that? So you don't have to second it.
Okay. Does anyone want to talk about or have a discussion on the 200, like changing or proposing the tobacco sales from 150 to 200, or maintaining it? Anyone? So the only thing that so I don't hear anything. Do you want to put a motion? Like you can.
Yeah, I mean, the reason why I'd like to see less like regulations on smoking. I think that people know that, but on the fees, I think this is behind the times. I'd like to make a motion that we increase it to $50 more to
Okay.
200
There's been a
annually.
motion to increase the tobacco sales fee from 150 to 200. Do we have a second on that motion?
I'll second it.
Okay. So there's been a motion and seconded to increase the tobacco sales from 150 to 200. All in favor say aye.
Aye.
Any opposed? I hear none.
Okay, this is a frivolous comment, but could
Go.
they never put it in green again? Because I have no idea what any of that says.
Oh, yeah, hold on 1 second. So let's just continue with it. So 200, no one opposed. Chair votes aye as well. So we can change that to $200 for the fee for tobacco sales moving forward.
So I didn't realize you hadn't finished
No,
that.
that's okay. That's okay. And then we get to put the proposed revisions as far as those, the body art apprentice and the collection fees to, so those two would be the wording first 6 months to be deleted, removed, and then remove all the Sharp collections. So those in green are all the Sharp collections.
Thank you very much.
You're very welcome. And the body art apprenticeships, it's just that 3 to 6 months that's crossed off.
That's just
Yep.
wonderful. Appreciate that.
Yeah, absolutely. So do we have a motion?
Yeah,
for
I
those
make a motion that we do revise edit with the edits just spoken of in
Okay.
green.
Perfect. Do we have a second for that?
I'll second it.
All right, so a motion has been put forward and seconded to revise the proposed revisions as far as the body art apprentices and all the Sharp collection fees. All those in favor say aye.
Aye.
Any opposed? I hear none. Motion has been put forward. Motion passes. There we go. All right, so that's the next one. All right. Next, old business. Board of Health mission statement. So we're returning on the discussion of updating our mission statement, or if there's any final revisions. So I would suggest a motion to adopt if there are no revisions, but we can, if there's any revisions that anyone would like, let's discuss that now.
I really like it.
I will propose a motion to adopt the Board of Health mission statement as proposed.
Okay.
I'll make a second.
Okay, motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. Motion passes. Okay. Next would be continuation of fluoride discussion on the next step. So that's basically, it's been an issue in public interest, various viewpoints expressed, and you know, I think as a board we've mentioned it and I've mentioned it, we're committed to public education, open and transparent discussion. So what I'm thinking for this is, and I'm still trying to get some more information, you know, any policy changes regarding fluoridation, it has to follow a bunch of different rules. So it's not something that I believe that the Board of Health can or cannot remove or do anything like that. So I'd like to propose that we host a public informational workshop. It's not a hearing, but an educational session for the public. And I know that there's been some educational stuff out there already, but I would like to propose 1 to 2 experts speaking on the the case for maintaining fluoridization, but also 1 to 2 experts presenting the concerns and rationale for its removal, not just one or the other, but both. And obviously, I would like to allow time for the audience to, public to comment and have public, notice several weeks. So this is not something that's going to happen in the next couple of weeks, because obviously we would have to organize things to ensure residents have informed and been prepared. So we can discuss what your thoughts are on this matter. If you want to put a motion or entertain a motion to do that.
I think it's a great idea. We've talked a lot about it, and educating them is so important. My question is, how do we choose the experts without being
Bias.
exactly?
Correct. Yeah, so that is something that I was thinking of as well. So I was thinking we could appoint like a planning liaison or subcommittee per se, but I would think, there's the open meeting laws, and that's not anything against like the open meeting law. So if we have more than the consensus, we would have to publicize it, but we could do 1 or 2 board members who are the liaisons to coordinate like the logistics, and then contact potential speakers, and then report back at the next meeting. So it would always be something that we'd be like, hey, this is what's on the table, and I think that it would be something that as a board, we could probably be like, okay, this is great, or not. And I'm still getting, I did put out a request from the MAHB, which is the Massachusetts Association thing, to give me some more information of those logistics as well, and to, what's available or not. So this is something that we may not be able to do, or we may be able to do, but this is just something that if we can, I'd like to put it forward so we can start moving on it and seeing where we're at with that.
I'd like to be one of the members if I could, but the only concern I have is though when you have more than one on each thing, that's more time you have to give. So that's my only concern.
Yeah,
You
and
gotta
I
make
said
sure-
1 to 2, but we can, I was just saying, like, I don't care.
No, I don't mind the number. I'm concerned that you have to have a time limit because we're not
Oh,
going to have,
absolutely.
it's not a debate.
No.
No.
And that would be the thing. And so one of the things is like this is the 1 to 2 speakers, and we would give them a time for, like, we would have rules.
Right.
So this is the whole thing of just like, this is what we're kind of planning. And then once we have that, we can then set up the rules. So if we know we have 1 speaker versus 2, or if we have 4 speakers versus 2, we would then time constraint each one of the speakers for each side.
Right.
And then for the public part, also set the rules above of how long they have to speak, and acknowledging and knowing that it's not a back and forth, it's not a question and answer per se, but just a testimony. And if there is any questions that it can come in front, like we can then be like, okay, you can answer, you have a minute to answer that question if it's something, but it comes from the board, basically.
Right.
And just keeping it handled and controlled pretty much, because it's not a debate, it is not to go back and forth, it is not about, I think it's great that people are passionate about things, but I also think that, we have to keep it in a systemic way as well for both sides, no matter what. You were going to say?
Well, I think we could be limited by just who's available to speak, so we might only get 1.
Right.
There's value in having 2 on each side, because especially dependent on their backgrounds. I mean, the dentists that we watched online or something like that were, because they both came from the same background, I don't know that we got a.
We didn't.
Abroad.
We didn't.
Yeah.
That
No.
was the whole thing. We didn't.
Yeah,
Well, I didn't want to-
and I do know, like, the one in the
I
town.
don't mind. I don't mind being controversial.
Yeah, and I know that there was another one that I think the library, was it the library? I know that they just had one too. But again, it was, I believe it was a dentist as well. And so, and that's where I think that, it's great to have both. I think in any situation, there's stuff to show both, so I think it's important that people hear from, an expert or someone with an expertise background, whatever that may be.
Right.
And what may be considered an expert for one may not be considered an expert for another, so.
Correct.
I'm sure that will come up as well, but that is something that we can put forward and see what we have. And, it may not work, we may not find people.
Correct.
And if that happens, we can always shut it down, and move on. So there's that. I mean, that's where I'm at.
I'd like to be involved.
Okay. Anyone else would like to be involved?
Seeing as how I don't know what the wellness committee's going to be.
It's every three months.
It's June 4th, I know.
Yeah, it's every 3 months. It's not.
Well, I mean, I can give George a hand.
You're gonna-
Send people his way.
I wa-
Call this
Okay.
person.
I want to tell you that you're going to do a phenomenal job.
So actually, first,
I'm not
before
saying
we do
against this.
that.
You can join in
So
anyone you
before
want.
we do that, I'd like to entertain a motion to formally approve the planning of a fluoride informational workshop as described.
I'll make a motion, formally approve the workshop, informational workshop for the
Okay.
town.
I'll second.
So motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. That passes. And then I would like to put a motion to appoint 1 to 2 board members as liaisons to coordinate the logistics, speakers, and, reporting back on our next regular meeting. Do we have a motion for that?
Yes, I'd like to motion that we choose 2 board members
Okay.
to coordinate.
Do we have a second? Do we have a second?
I'll second that.
I'm trying to get through this.
No, I was almost not, I didn't know if there was
really trying to get
another
through
board
this.
member that wanted to do it, so I didn't want to make it the motion.
All right, so motion has been put forward and seconded. All those in favor say aye.
Aye.
Any opposed? I hear none. Chair votes aye as well. Okay, and then with that, we have the 2 people that have volunteered themselves. Anyone opposed to that? I hear none. So moving forward. Thank you. I appreciate that. And are there any further comments on this item before we want to move on?
I don't have any.
Okay. All right. So next would be the Health Department report. Steve?
Well, obviously, we've been pretty busy. Actually, staff has been doing an excellent job of keeping up with things as far as permitting is concerned and inspections are concerned. We have both Lisa handling things up front as people are calling in for things and handling the counter. She's doing an outstanding job. Siobhan, who hasn't been in the position very long as an inspector, has just been really outstanding. And then with Ashley, our health nurse, another outstanding performer. So things are going well. I think, staff has taken a look at the body art regs and had a few additional comments on that. And again, it's to just try and handle this in a collaborative way so that we're all kind of working together. In addition, I think we just put on, Lisa and I were working on getting variance requests for grease tanks on our permitting system. So that's online now, and we probably will have 1 or 2 that'll be coming before the board shortly. And I think most of you may not have experienced this yet, but grease tanks continue to be issues with restaurants and how we designate who puts in an external, which costs a lot of money because you're digging up parking lots versus what we allow for internals as alternatives. So that'll be coming along. And geez, have I forgotten anything else?
There's this to.
Yeah, the health.
That's different, but yeah, no. Yeah, we got that shared document.
Yeah.
So that's helpful to see the changes.
Yeah, that just makes it easier for everybody, so we all understand what we're talking about, so.
Yeah. So I'm guessing that can probably come before the what would be the next step?
Well, so I wanted to share it before, I wanted to share it with both Melissa and Susan because they had worked on it before. So if you're okay with those changes, then we'll share it with the rest of the board. I know there was a vote in the past, but there's some things that you may, look, we could do it one of two ways. Either, Pam, Chris, and George say, we'll accept whatever was done and just let it go to town council, or we can bring it back and you can take a look at it.
Okay.
Doesn't matter. It's
I have the utmost belief that it's okay with me, so.
Do we need to vote on that, or
No,
just
I'll just,
Yeah.
The board to know that.
Okay.
well, right, and
And Chris isn't
No,
here,
They were
so,
working on a couple of meetings.
Yeah.
They reported back a couple of meetings I came to when I
Yeah.
wasn't here.
yeah. And Chris isn't here, so I guess we can just ask. And
we'll
make
forward,
sure-
then I'll
yeah,
just
move
send it off to
forward.
town
Yeah.
council.
Okay.
Yeah, so everything's kind of just chugging along. It's been a
Great.
good summer so far, or good spring so far.
Yeah. Yep. All right.
Madam Chair.
Yeah.
On behalf of the committee, myself, I'd like to mention to, if it's okay with you, I'm sure you'll, wanted to mention that, I wanted to tell Steve that really appreciative of the information that Siobhan's giving us. So all of our workers, we appreciate them, but wanted to mention that just because that's the way that we deal with the folks in the department. That she's doing an excellent job in informing of us what we need to know. Thank you.
Yes. Did you need to speak on the
I don't think so. I mean, I think that was
tobacco cessation? Okay, perfect. All right, so subcommittee reports. We have Tewksbury Cares. So that is something that I am also looking into as far with the MAHB on what we can and cannot do as far as, because it is a 501c, there is still money in there with the Treasury. However, it's not up and running. It's kind of dissolved. It's not been going anywhere. So I'm not sure if it's something that the Board of Health, if we need to have a subcommittee of some sort, and if we do, then we would have to figure out what to do with that. And if we do not, then what we would need to do to dissolve it and where that funding would go. Steve, I'm not sure if you know about any of that, if you have any familiarities. I'm still looking into that as well. My thought process is I would like, I had a thought of if we cannot dissolve it and because there is funds in there, using it as doing like monthly educational things for the town. I know like different towns do like blood pressure screenings, and yeah, we probably do that here too, but maybe we can add it on as a Board of Health collective, doing those types of things for the community and the residents versus the original, but I think that also has to change the description of the whole thing. So there's a lot of legalities to it still. So I am finding out as much information as I possibly can to figure out what to do with it.
Please feel free to send me any information you have so that I can look at it.
Yes,
and
I will.
We can discuss it.
Yeah. And then I know the Wellness Committee isn't on here, but do you have anything on that? I know that you just
No, it
started,
meets
so.
June 4th.
Okay.
We haven't met yet.
Okay, so the next meeting is June 4th? Perfect. And then moving on to the next board member reports. So there's just an informational item. It's the Mass DEP notification for 1470 Shaw Sheen Street. So that was basically, hold on, I have my little notes here. Where is that? Maybe not. Where did it go? Yes, it is here. So it's just to notify the board and the public that there was a correspondence received from Coneco Engineers and Scientists concerning East Tewksbury number 59, located on 1470 Saw Street. So they had submitted a permanent solution with no condition statement. So that's related to a past release of PCB mineral oil on the site. It's been reviewed, accepted by the Massachusetts Department of Environmental Protection, and it formally concludes that the release does not pose a significant risk to the public health, safety, or the environment. So no further remediation or cleanup were required or are required. So it's just for informational purposes because this letter was sent in my name, but to the Tewksbury Board of Health in this thing. So I just wanted to bring that out to people. And then I just wanted to include that in the agenda for transparency.
Thank you.
Any questions or discussion on that?
No, I'd just like to see you check it out, you got your eyes looking around at a lot of stuff.
I know.
I like that.
It was on my
We've
thing.
talked about-
I didn't
we've
even
talked
know,
about
and I was like, okay. And so that was dated, I don't even know.
March 14th.
March 14th. Yes. So, all right. So now members may now propose items for future agendas if they'd like, or we can skip that. Anybody have any items for future agendas that they'd like to propose?
I don't at this time.
Okay. None?
I would like to focus on what we have.
All right, yeah. So hearing no further business, may I have a motion to adjourn?
I make the motion that we adjourn our meeting.
I second.
Okay, motion and seconded. All in favor say aye.
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 Any opposed? I hear none. Vote, chair votes aye as well. Motion passes. Our next meeting is scheduled for Thursday, June 26th, here in the main hall. Thank you, Tewksbury. Have a great night. It is, hold on, 8:17 p.m. Thank you.